Hello, and welcome to the webinar entitled Dispensing Prevention, How Pharmacists Can Fight the Opioid Crisis by Educating Consumers on Safe Drug Deactivation and Disposal, hosted by the National Consumers League for the Script Your Future Teen Challenge. I'm Jeanette Contreras, Director of Health Policy for the National Consumers League. In January, we kicked off the 11th annual Script Your Future Medication Adherence Teen Challenge, and we're excited that this year we'll be adding safe drug disposal as a new consumer education topic. Today, I'm joined by Erica Webb Belzer, Vice President of Marketing for Verde Environmental Technologies, to discuss safe drug disposal and the package that all the schools will be receiving to help support this new outreach. Erica, we're thrilled about your partnership and thank you for joining me today. So can you please tell us a little bit about what Verde does?
Jet, thank you so much for having me. This is great. We're really excited too. So I work for Verde Environmental Technologies. We're the maker of the Deterra drug deactivation and disposal system. So Deterra is a medication disposal system that permanently destroys over-the-counter and prescription medications, including opioids and fentanyl. Deterra uses activated carbon and tap water to render drugs inert and non-retrievable for all practical purposes. And it's the only product on the market that's scientifically proven to destroy those medications.
This sounds like an amazing product. Can you show us how the Deterra pouch works?
Yeah, I'd love to. Okay, so this is what our pouch looks like. And you may have seen them. This is our MP. It's a medium pouch. It deactivates 45 pills at a time. It also works on liquids, creams, films, and pills or capsules. And so it's a simple 3-step process, and I'll quickly show you. So here's the pouch. You just tear open the pouch. At the top, it's perforated, and you open up the pouch. I have that ready. You open up the pouch, and you place your medications inside. I have pills here. It could be liquids, creams, films, patches. Dump them inside, and then you fill it halfway with warm water. I'm just going to use tap water this time, and that's fine. The deactivation process starts immediately, but it can take time depending on the medication that you're deactivating. It can take time to fully deactivate. You put it in, you wait 30 seconds, you kind of seal it around. There's an activated carbon pot on the inside that has a film on it. The film is, it disintegrates with the water, and then the medication and the carbon interact. So you leave it open for 30 seconds. And then after that 30 seconds, you can seal it and place it in the household trash. So I'll just leave it open for a couple of seconds before I put it in the trash. The one thing that I wanted to call out is we do know that this pouch gets used. It's pretty great. We did a couple of studies. One was our NIDA study, and it showed that 96% of those given a Deterra pouch use it within the first 4 weeks or sooner, with nearly 50% of those people using it within the first 24 hours, which is pretty amazing. And we had the University of Michigan did a study, and they published that in JAMA Surgery, and it shows that patients with leftover medications, specifically opioids, who are given the pouch are nearly 4 times more likely to properly dispose of those drugs using the pouch. So it's pretty great.
Yeah, and that's super important. We're going to talk about why this is important. But thank you so much for shipping these to our students, our schools.
Yeah, you're welcome. So thank you, like you mentioned, thank you to the participants of Script Your Future campaign. We did ship boxes of a sample box, I'm calling it, with about 15 pouches and some educational materials and dispenser education materials. So those should be in the faculty advisors' hands. If not already, they will come this week. So.
Great, thanks. So let's get into the discussion. Let's talk about why safe disposal is so important. And, you know, as a mother, this comes to mind to me. It's scary to think that most people who misuse prescription drugs are between the ages of 18 and 25. You know, prescription drug misuse and abuse has been on the rise, and this pandemic has only exacerbated those issues that typically drive people to self-medicate, right? I looked up this really scary statistic. So according to the Partnership for Drug-Free Kids, 2/3 of teens who misused pain relievers in the past year say they got them either from a friend's home or their family's own medicine cabinets. So this is not a new issue, but making safe medication storage and disposal is really more important than ever. You have a teenager at home, don't you, Erica?
I do. You're too, and I agree with you. It is something that we need to think about, and it's scary to think about. Teenagers are, an extremely high risk group, and then being stuck at home with the pandemic, it's certainly tougher on them and our young adults. You had a statistic, and we also have a few statistics that we use. One of them is that 62% of teenagers say they chose to abuse prescription drugs because they're easier to get from parents' medicine cabinets, and 35% say they use prescription because they incorrectly believe that prescriptions are safer than illegal drugs. So that really resonated with me when I read that. I didn't think about it. So it's something that we do talk about in our household. I don't know if you do too, but that one was a little bit scary.
Yeah, especially when I go to visit my mom and I see that she's got her pills readily available, and then you have little ones running around. So safe drug disposal is important, not just for, the opioid crisis, which is certainly top of mind, but even just for safety reasons of you don't want children getting into grandma's, drugs. Her prescription drugs could be harmful, even if they're just the cholesterol meds, they look like candy to them if they're easily available, and so we want to talk about some other important reasons why safe drug disposal is needed, right?
Yeah, you're right. And another huge risk is the environmental impact of those medications when they aren't properly disposed. So, we don't think about that all the time, but that is an impact.
Yeah, and you guys do a really great job of this, in terms of like the environmental impact, and it's something that, again, that like consumers don't think about. So improper prescription medication disposal can lead to drugs leaching into the water system. Again, we just don't think about tossing it into the landfill, but we shouldn't toss these, medications in the trash or flush them down the toilet. And then the only time I hear about safe drug disposal is during those periodic drug take back days, that you always seem to miss, right? So it's, again, super tempting to just toss them in the landfill with the rest of your trash.
Yeah, you're right. And we do believe that those drug take back days are so important. We always say that doTERRA complements drug take back days. And we do have a number of pharmacies and law enforcement agencies who actually hand doTERRA out when at those drug take back days. There is something that we included in the sample box for all of the participating schools, and it's called our Take Two ESOL. And what people use that for is it's take one for later and one for your neighbor, so that you can start that community spread to help remove drugs from circulation, but then also keep our environment safe. And it's becoming so critical for our environment, because we just looked up a statistic the other day, and in 2019, there were up to 200 pharmaceuticals detected in surface water, groundwater, and drinking water in the United States. So it's something that's really that leaching into our soil, our water, and into our air it's out there. The other thing that really have been thoughtful about is we don't want to just add another plastic bag to our landfill. And so when you look at our pouch, it does look like it's, it's plastic, but it's actually made out of plants. It's a plant-based pouch, which is pretty great. It's made out of sugarcane. And the carbon on the inside is organic. We do have a smaller carbon footprint due to its plant-based packaging. The packaging is USDA certified. It's 50% or more bio-based, depending on the size that you choose, because we have multiple sizes of pouches. And then it's made in a facility that uses 100% wind-generated electrical energy. So we've been really thoughtful about how we produce this so that we aren't harming our environment. We're pretty proud because we just won, it's called the SEAL Award in 2021. And we're in the company of organizations like Salesforce and PepsiCo. And we won it for the sustainable product category, which is pretty amazing. And SEAL, if nobody knows what that means or anybody doesn't know what that means, it's just sustainability, environmental achievement, and leadership. So we're pretty excited about the environmental impact that our pouch has.
Yeah, and that's super amazing for a small company, right? You guys are just a small company. This is just, it's really, you guys have been doing, I think, did a great job of thinking everything through, so smart company, smart product. So let's talk a little bit about what the role pharmacists can play to make safe disposal happen.
Yes, I know we've gone through a whole bunch of statistics and they are staggering, but the crisis does not have to be insurmountable. So we can do this together. We always talk about how this isn't just one person or one organization or, doing this work. We can do it together. What we've heard and what we believe is that education is key to helping with this. A lot of people don't know what disposal options are out there, and they also don't fully understand how to properly dispose of their medications. We get a lot of emails saying, how do I dispose? What's the best way? So we do believe that pharmacists have such a great opportunity to help.
Yeah, that's great. So we know that, the doTERRA bags really are helpful with the at-home disposal, which is clearly the most convenient option, but consumers can also find, a short list of authorized collection sites in their communities. Like if you're using Google Maps, you could type in drug disposal near me or medication disposal near me. Some of the typical collection sites can be retail, hospital or clinic pharmacies, or law enforcement facilities, but they're also not always available in all communities. So there really is, I think, still a large gap to be met with this.
Yeah, I agree. And, we do partner with a lot of pharmacies out there, and many of them are handing doTERRA out and they're co-dispensing it. So they're co-dispensing with any medication that they're prescribing, or dispensing it with just the opioids and fentanyl. So it really is helpful.
Yeah, that's great. Well, I think that safe drug disposal bags should really be more of a household item, right? Something that every house should have. We should, as consumers, think about this, particularly as we're thinking more about, our environmental impact, on the planet. So I hope that this year's Script Your Future teams will share this info with their patients and with their communities. Erica, we so appreciate you sending these drug deactivation bags and educational materials to the participating schools. We've also added information about the safe drug disposal to the Teen Challenge participants page. So we hope that it'll be helpful, and we look forward to hearing feedback from the teams about this new addition to the Script Your Future consumer education campaign as well. So Erica, thank you so much for joining me today for this great discussion.
Thank you, Jet. It's been a pleasure.